you're having trouble getting around. Walking is a big pain. So you find yourself just kind of hanging around your pad. Well, PAD could be the reason your home is becoming your haven. PAD is really P-A-D and stands for peripheral arterial disease. Dr. Mireille Moyes is an attending surgeon at Metro Health, and she's here to spell out the signs and symptoms of this really serious condition. Happy to have you here. Now, we talked about the acronym, but what does that really mean, the PAD?
So peripheral arterial disease is from atherosclerosis, which is commonly known as hardening of the arteries. And as you age, as well as some other risk factors, smoking, high blood pressure, high cholesterol, they can all contribute to hardening of the arteries, which can lead to narrowing, and in worst cases lead to blockages.
Okay. Is this heart related, or is this other places in your body?
Well, atherosclerosis can affect any blood vessel in your body, most commonly is the heart. But the second most common place is the legs, and it starts off with pain with walking.
All right, yeah, so in your legs. So what you mentioned briefly some of the risk factors. Can you go a little bit more in depth on some of those risk factors for us?
Well, smoking is number one.
Oh boy.
You often hear about smoking and its effects on the lungs, but smoking is actually toxic to the blood vessels. And over time, 20 to 30 years of smoking can lead to plaques that can lead to blockages
so
and
it's not necessarily
narrowings.
cholesterol. I'm sure that has a factor too, but so I think we have up on the screen too, cholesterol, as I just mentioned, smoking like you mentioned. So how about these other things?
Well, aging, we're all aging. That's not a risk factor that you can modify, but you're
Yeah.
we wish. But diet, high cholesterol is a very important risk factor that can be managed, as well as stopping smoking.
Okay. So it's like everything in health, right? Exercise, eating right, taking care of yourself. So whether we have the risk factors or not, what are the symptoms of the condition so we can kind of recognize if it's happening?
So the symptoms generally start with pain with walking. And the kind of pain that you have, it doesn't start right away. As you're walking, as you're moving, as your muscles are working, they're asking for more blood, more oxygen from your heart. Your heart tries to provide that, but the blood is trying to squeeze past all those narrowing and blockages. It doesn't get there in time, and you get pain, just like a muscle cramp, usually in the calves.
Okay.
People will stop and rest for 2 to 3 minutes. The pain goes away. And then once you start again, the same distance, sometimes a little bit further, once again, the cramping, usually in the calves, sometimes in the thighs.
Okay, but it's not actually a cramp because it goes away, right?
Right. Well, it is a cramp because the muscles, they build up with lactic acid, just like when you do heavy exercise.
So it really is a cramp, but
really
it
is a cramp.
relaxes itself faster than a regular cramp would? Or?
Right, because you're at rest, your muscles don't need as much blood. So it dissipates over time, but then once again, once you start walking, the same pain.
Wow, sounds like it could really harm your legs too. Now I know if we feel a pain now and then, don't just put it off to old age, which I bet a lot of people do. It sounds like you really need to see your doctor for something like this.
Right, if it's regular and recurrent, then you need to see your physician, because then you can talk about some of the risk factors that you can modify to improve your walking distance, but also improve your heart health as well.
What if you've already got it? Is there any treatments?
There are some medications that can be used. Occasionally it can come to either angioplasty and stenting or surgery.
Okay, so it's something we can do, but we'd rather not get it in the first place, right?
Right, exactly.
Okay.
So if you increase your physical activity, eat right, stop smoking if you're a smoker.
Good information. Leg pain when you walk is worrisome. Don't just try to walk it off. See your physician to see if it's peripheral arterial disease. That's a step towards healing. My thanks to Dr. Moyes for joining us today.
Thank you.
To learn more, call Metro Health at 216-778-7800 or visit www.metrohealth.org. Next, understanding your Social Security statement.